me start off by saying good morning to everyone, and there'll be a number of speakers this morning, but I certainly want to acknowledge some of them at the very beginning. We have standing with me is Councilmember Carlos Cisneros and Councilmember Jack Christie, who's here. Councilmember, come on, get a little closer. And then, of course, we have Frank Vasquez with the Houston VA Medical Center, the director. And then we have Wayne Young, the CEO of the Harris Center, Monique Rodriguez from Combined Arms, Dr. Stephen Hall, who's the director of the Office of Veterans Affairs, and Mr. Stroud, who is also standing with us, who is a veteran. And then I also want to acknowledge, though she's not standing here, but Betty Beckworth, who is the program director with the Texas Department of Health and Human Services, and Betty and I have known each other for a number of years, a long time. So good morning and welcome to Houston City Hall, where today I'm joined by several local organizations to highlight efforts to prevent suicide amongst those who have served our country. In fact, just off the beginning, I think there are about 20 veterans a day that commit suicides nationally, and we want to make every attempt to reduce that number down to zero. In March 2018, I was privileged to accept the Mayor's challenge to end suicide among veterans, service members, and their families. Houston was one of the original 7 cities to participate in the Mayor's challenge, organized by the U.S. Department of Veteran Affairs and the Substance Abuse and Mental Health Services Administration. The Houston's Mayor's Challenge is a partnership between the City of Houston Police, Fire, Health, and Veteran Affairs Departments, the Houston VA, the Texas Health and Human Services Commission, the Harris Center, the Council on Recovery, Combined Arms, and other local agencies. Partnerships between our local community, government, and nonprofit agencies will allow us to reach our Houston area veterans where they live, work, and thrive. We want to expand the conversation around suicide and reduce stigma for mental health and suicide. And using a public health approach, the Houston Mayor's Challenge team has developed multiple new and innovative strategies to prevent suicides in service members, veterans, and their families. The Harris Center and the Houston VA now have a hand-off system between the two agencies to assist with the care of veterans, and I want to thank them for that. A network of communication between local hospitals and the VA to assist with veteran care is being built. And the Houston Police Department and the Houston Fire Departments are better able to identify suicidal behavior related to events and will begin referring people to ensure follow-up care is offered. The Houston Health Department is working with hospitals and the Houston VA to enhance care coordination for veterans who are discharged after suicide attempts. And all Houston Mayor's Challenge agencies have examined and refined the way the language is used with veterans to be in line with best practices to identify those who have served and their families and to not trigger those that are in crisis. At this time, let me bring up Frank Vasquez, who is with the director of the Houston VA Medical Center, and I've had the privilege of working with Frank on so many different levels. Frank, thank you for being here.
Thank you for having me.
Thank you.
I want to thank Mayor Turner and everyone here today as we focus our attention and the attention of our community on the topic of veteran suicides. With so many veterans living and working in Houston and in Texas, it is important that we raise awareness of this important issue throughout our Suicide Prevention Month and beyond. As a veteran myself, it is my honor and privilege to serve the over 113,000 veterans that receive care at the Michael E. DeBakey here in Houston, and preventing veteran suicide is our highest clinical priority at the VA. We are committed to bringing as many resources as possible to bear to solve this issue here in Houston. Over the last year, the Houston VA has hired more than 100 new frontline mental health providers, including psychologists, social workers, psychiatrists, and more. We have a virtual army of new mental health providers ready to care for our veterans here in Houston. A few months ago, we opened a brand new mental health building for outpatient mental health on our main campus, and the new building offers outpatient mental health services for veterans from all eras. The Houston VA also offers a robust marriage and family therapy program, and we've hired 8 licensed marriage and family therapists to assist veterans and their families. Houston, as you all know, is home to one of the largest, most complex VA medical centers in the nation. We have the busiest ER and one of the busiest OR of any VA in our country. We have vigorously trained our staff of over 5,400 on how to recognize and assist veterans in crisis across our VA. We have embedded mental health professionals in our primary care clinics to reach veterans where they are, and we are embedding more and more in our specialty clinics like cardiology and women's health. The Houston VA has 6 full-time suicide prevention coordinators who work tirelessly to follow up on calls from the Veteran Crisis Line and assist veterans in crisis. 2 of them are here today. These clinicians dedicate their lives to providing care and support to veterans in crisis. We also offer at the Houston VA same-day mental health care for veterans in crisis at our main medical center and any of our 9 community VA community-based outpatient clinics in the Houston area. Our staff of over 5,400 consider it an honor and a privilege to serve our nation's heroes, and we take this issue very, very personally. It truly is a tragedy if even one veteran who served our country in the United States Armed Forces dies by suicide, and we're committed to doing everything we can do to end veteran suicide. Bottom line is that suicide is a complex issue with no one single cause. It is a national public health issue that affects people from all walks of life, not just veterans, and for a variety of reasons. But just as there is no one single cause of suicide, no single organization can end veteran suicide alone. So the Houston VA is proud to be a part of the Houston Mayor's Challenge, working with the amazing people here today and all members of our Houston community to put an end to veteran suicide. I am so proud that our great city of Houston was one of the first cities to step up to participate in the National Mayor's Challenge. And working together, we can end veteran suicide. We know that treatment works and that recovery is possible. So we're working hard to find ways to encourage veterans to connect with the care they need and deserve. Please help us spread the word. Houston VA is here for our veterans. We offer our veterans high-quality health care delivered in a veteran-centric manner with a sense of urgency, and we want all veterans to know that we're ready and able to serve them here in Houston. I thank you for having me here, Mayor. I thank you for the great collaboration we have in the community. We're going to keep working hard for our veterans. We're honored to do so. And as a son of a Korean and Vietnam-era veteran and the father of an Army veteran and a veteran myself, we are committed. We have great staff who's really committed to what we do. We're not perfect, obviously. We have challenges, so that's when we ask for a feedback so we can get better and we can improve each and every day. But we work hard every day, and we're proud to do so, and we're just very honored and privileged to be part of this effort, Mayor. Thank you for having me.
Thanks, Frank. Thank you, Frank, and thank you for your leadership. And I also want to acknowledge Jane Cheeks, who's the Director of Human Resource here at the City of Houston. Jane, please wave your hand a little bit. And then Steve Williams, who's the Director of the City of Houston Public Health Department. Thank you, Steve, for your leadership that you're providing to your department. At this time, let me bring up Wayne Young, who's the CEO of the Harris Center. Wayne.
Good morning. The Harris Center for Mental Health and IDD is proud to be a member of the Mayor's Challenge to prevent suicide for veterans and military-involved families. The mission of the Harris Center to transform the lives of people with behavioral health and IDD needs is strengthened by the work that we're doing in this project and with these outstanding organizations that are here today. The Harris Center has long served veterans and military-involved families and has worked in collaboration with many community partners over the years. One of the key successes specific to this work that has been done and a result of the Mayor's Challenge is that we have become the first local mental health authority in Texas to have a memorandum of understanding with the Veterans Administration, allowing us to partner directly with them and ensure that veterans who reach out for services whose care can be enhanced By partnership and integration, we can achieve that through those relationships. This isn't simply another piece of paper. This isn't simply something that is a document signed and put in a drawer. This allows us to provide the warm handoffs, the direct clinical connectedness that already to date has seen over 60 veterans connect with services, be engaged by our mobile crisis outreach team, and provide behavioral health supports with the long-term goal of connecting them with behavioral health services and supports. The partnership has been so effective that the Governor's Challenge is making the recommendation that the template that we've developed with the Veterans Administration be used as a model for every local mental health authority in Texas to adopt and put in place so that we can ensure our veterans don't fall through the cracks of handoffs between systems. I will also mention that in conversations at a national level, it's been engaged, and the idea has been floated that perhaps this can expand even beyond the state of Texas. Through the Mayor's Challenge, the Harris Center has also been able to leverage training opportunities to expand our knowledge and develop our expertise working with veterans and military-involved families, and therefore ensuring our clients are accessing all of the available services that are in place in our community. The Harris Center was recently designated as a regional suicide care support center by the Texas Health and Human Services Commission. As such, we are the technical support and training hub for all local mental health authorities and other community partners in our region. There are only 3 regional suicide support centers in the state, and we are honored to be one of those 3. The Harris Center's ongoing commitment to veterans care, suicide prevention and intervention, and ongoing behavioral health supports has made our work on this project impactful and effective. With that, Mayor, I want to express our appreciation for being included in this important work, and thank you very much for having us here today.
Thanks, Wayne. Appreciate you. And I certainly want to thank Wayne and appreciate the Harris Center for working with us on multiple levels. At this time, let me bring up Monique Rodriguez with Combined Arms. Monique.
Thank you, Mayor. The mission of Combined Arms is to unite the community to accelerate the impact of veterans on Texas. Combined Arms currently serves about 250 veterans a month and their families, connecting them to quality resources in the community. Combined Arms is also proud to play a role in the prevention of suicides in our community. Through the agreements in place with both the VA and the Harris Center, we're able to coordinate care for veterans we engage with that are in need of mental health services. We're also a distribution site for VA gun locks to ensure that veterans and their families have the ability to secure their guns. Combined Arms also has a partnership with America's Warriors Partner, as well as the University of Alabama, in being able to conduct a research study here in the Houston area that will really, the project is called Operation Deep Dive, and what essentially we will be able to do is deep dive into the data of the veteran deaths that have occurred within the last 4 months to really get us an understanding of why these situations have occurred and how we can grow from that. And this data will then be fed up to the Mayor's Challenge, which then will have the ability to act upon some of those recommendations that come out. We'll be interviewing family members of next of kin to really get their perspective of what happened prior to the death. So we're excited about gaining new knowledge and insights from a whole different perspective and be able to use that to be able to make our community stronger. Thank you.
Thank you, Monique. Let me also acknowledge Sergeant Norris Groves with HPD Mental Health Division. Where's Sergeant? There you are. Thank you, Sergeant Groves. Why don't you come and stand with us? And then also a representative from Congresswoman Sheila Jackson-Lee's office. Thank you for being here as well. Let me bring up Dr. Stephen Holm with the City of Houston. He's the Director of the Office of Veteran Affairs for the City of Houston. I want to give Director Holm a great deal of credit for the Mayor's Challenge. Is that his initiative, moving it forward, initiating it. So it's the Mayor's Challenge. But let me tell you, behind the Mayor's Challenge is are these veterans. So thank you to Mr. Holm. Mr. Dimbo, thank you all so very much. Stephen Holm.
Thank you, Mayor. I'll be brief. I'd like to echo what's been said here today by this community of stakeholders. These are true servant leaders who understand and uphold the notion that this is a much larger issue presented before us. This issue is larger than citywide, it's larger than statewide, it's actually larger than nationwide and goes beyond that. And it calls for each of us to do our part. It's times like this and in times like these that we are called to act intentionally, to strive together, and to seek for solutions, and to truly be our brothers and our sisters' keepers. Most importantly, and I'd be remiss without doing this, is today we want those to know who are in crisis or possibly in crisis, to let them know that help is available. The 24-hour Veterans Crisis Line is 1-800-273-8255. That's 1-800-273-8255. This number is good for everyone, but if you are a veteran or you're calling, you can press 1 or call 911 for immediate assistance, especially if someone is threatening suicide or has injured themselves. We want you to know that help is always available, 24/7. And the VA, Houston VA, is our nearest local emergency room. Thank you for this.
Thanks, Director Hall. And this issue is very near and dear to Councilmember Carla Cisneros, so let me bring her up at this time. Councilmember.
Thank you. You know, some of the things I heard today that are so important to communicate to our vets. Treatment works. Recovery is possible. Help is always available. Those are really the biggest messages that I'm hearing from all of you, that we so need to do a really good job of communicating to our veterans. I wanted to just give a quick update. I represent the part of town that has Veterans Memorial Park, and it's a 21-acre site in the north part of Houston that has not had much happen out there. There's a World War II memorial that was vandalized that we are now working to restore. There's a Vietnam veterans group that is working to raise money to have a new memorial put there. But I want you all to know that there's a real focus on how do we activate this space? How do we really make it a place that becomes part of the holistic approach to how we support and respect our veterans? And there's so many exciting opportunities here. One of them is that, there are so many women vets that are in our city that are not organized like the men are and are not really served as well. So I think that's an opportunity too, and how we reach their families that are so impacted by this. This park, I think, is a great opportunity, not just to have memorials to the war dead, but to be a living, active place that we can have things like obstacle courses that people would come to compete in, that the veterans, would be familiar with. Some place for the living. I think it's part of what we need to do. Anyway, some exciting things are conversations are happening. People are coming forward and saying they want to help. One of them is Commissioner Adrian Garcia. So we'll see. The city and the county are now talking about partnerships, and other corporations and all kinds of people are interested. So if you're interested, please let me know. I'll be around. Thank you so much.
Thank you, Councilmember. We love our veterans. And in Houston, we have one of the largest and most prestigious VA medical centers in the country, and our VA has immediate access to mental health services, and veterans can be seen the same day as you walk in. We call on our entire community to help us identify veterans in crisis. America's service members and veterans are strong, but some may face difficult times or even crisis. And Houston is a place where we take care of each other, which is why I'm asking everyone to come alongside me and the agencies and organizations in our Mayor's Challenge to prevent suicide and be there for the veterans in our community as they have been there for all of us. To someone going through a difficult time, your presence, your phone call, a wave at the mailbox, even the smallest act to a veteran has the power to save a life. You can learn more at BeThereForVeterans.com. BeThereForVeterans.com. And finally, a few notes for our media partners here today. You've noticed a table with gun locks and a toy gun in the room. The VA will offer demonstrations on how to properly use those gun locks and offer information about how to get a free gun lock. We also have an Army veteran here, Tim Stroud. Where's Tim?
Right here.
Tim is here, who can even talk someone about his own personal experiences. Tim, why don't I just bring you up right now? Tim Stroud.
Thank you, Mayor. Appreciate it, Mayor. Council members, thank you so much. And if you're not awake yet, I'm about to give you a verbal dose of caffeine. I've learned over the last 15 years of working in this field that facts tell, and you heard a lot of them today, and those are important, but stories tell. I'm going to share one of those quick stories with you, with one of the naval veterans that had come to one of the classes that we set up with Maureen for an Impact a Hero to teach veterans financial literacy, to get them into the circle of care that Dr. Laura Marsh talks about, is making sure that they start here. Maybe they need to travel through the entire circle, or they just need that little portion. But a couple of veterans came to to one of those sessions, and she saw a little tiny red flag, and it popped up. She's like, no, that's not for me. And later on down the road, another flag popped up. No, that one's not for me either. And pretty soon she saw another red flag pop up, and she's like, all right, that flag's for me. She called Mike and I, and she shared her concerns because she was taught the signs of noticing the struggles of going through post-traumatic stress. Sometimes it's not that hand raising up. Maybe they'll call 211, maybe they'll call the hotline, but sometimes it needs to be that family member, a patriot, or somebody in their circle of care that notices that they are struggling. She reached out, and she knew that through Easter Seals, we had a collaborative grant to help out. It was above our pay grade. And as a medic, I'm trained to seek higher help. We did that. We met him down at the VA. We made sure that his guns had locks on them, the ones that we had. He had a lot of guns. And then we put some stuff in place. And I can tell you right there, that act showed him that we cared. And we got him checked into the VA. We had to go through the ER services. He was at that point, if his wife did not see that flag, he wouldn't be with us here today. He went through the program at the VA. And let me tell you right now, he went through with no medication. He had a program that they walked him through because they had the learned knowledge, and they tied him to one of the veteran service organizations in the greater Houston area to have the activity knowledge. He got involved with one of the groups, the Mission Continues. He worked a service project that's out there. And so my message today is to join the Mayor's Challenge in Houston. But with that challenge, I'm going to issue 2 others. Know the signs and get involved with one of the veteran service organizations. Thank you, Mayor.
Thank you. And that's a fitting way to bring this press conference to an end. But before I do that, if you're a veteran, just raise your hand. If you're a veteran here today. Wow. Well, I'm not going to get into that Army, Navy, Marines, the Coast Guard, all of that. Yeah. The reality is, regardless of which branch, the city of Houston loves you and appreciates you, and we want to make sure that we do everything within our power to take care of you. And that's what's important. 20 losing their lives by suicide nationally is 20 too many. 15 too many. 10 too many. 5 too many. 1 too many. Just like we say, even with our streets, vision zero. We talk vision zero about our streets. We need to also talk zero when it comes to our veterans. So thank you all so very much, and look forward to working with you all to move forward on behalf of our veterans. Thank you. Thanks so very much.